Our next speaker is another early support member for me, Dr. Marc Futernick. Marc is an emergency physician and climate advocate, serving as the National Director of Sustainability for U.S. Acute Care Solutions, which is a multi-specialty physician services company focused primarily on emergency medicine. Dr. Futernick is a graduate of UCLA with a BS in biochemistry and the Chilean University School of Medicine. He completed his residency training in emergency medicine at UCSF Fresno in 2000 and has practiced primarily in LA since then. Dr. Futernick was an original founder of the Environmental Action Committee at Dignity Health, California Hospital Medical Center, and CHMC's environmental efforts have been recognized by Practice Green Health every year since 2013. Dr. Futernick is also the managing editor of the Open Access Journal for Climate Change and Health and serves on the board of directors of Climate Resolve, a nonprofit whose mission is to champion equitable climate solutions. Marc is going to be talking to us about heat and health impacts today and some solutions that we can look at as well. So please welcome Dr. Marc Futernick.
Awesome. So thanks again for having me here. So I'm an emergency physician, and I've been engaged in the environmental advocacy movement really for more than 35 years now. And about 10 years ago, I started to see that this was no longer a future thing and no longer a nature thing, and it was impacting my patients right now. And I really pivoted my career to try to focus on researching why this was happening, which I understood, but what was happening exactly in terms of human health, and most importantly, what we can do about it. And so I want to share some of that information with you today, focused on extreme heat, some objectives for the CME. One thing I'll say is climate lectures tend to be full of projections, which are really valuable and illuminating. But my particular lecture here today will not include any projections. Everything we're going to talk about is research of what has already happened and is currently happening, mostly to human beings and mostly here in the United States. I'm not going to spend much time on this because we just heard from Dr. Pierce, and I think everybody in the audience probably fully understands this. This is, kind of a depiction of the greenhouse effect. But I want you to notice that the greenhouse effect increases some of those squiggly red lines being trapped, but some still go out to space, and that will become relevant on a future topic. It's gotten hotter. I think we know that. This is a graphic that sort of depicts how different it is. So this is the baseline temperature in the United States, 1950 to 1980, and that green line will remain. And you can see at the bottom there are standard deviations, because if you go out to 3 standard deviations, that's less than 0.1% of the data points. And you can't really see it, but they're marking those magenta, and you're about to see more of them. So if we move forward into the 1990s, you can start to see that there are extremely hot days that really didn't exist in the previous decades. And now we're just going to jump to the 2010s, and you can see that there 22% of the days are extremely hot compared to what humans were used to just 50, 60 years ago. And then this doesn't even do the 2020s, which of course has some of the hottest years on record. And so this would move even further to the right. Sorry, it's catching a little bit. So let's talk a little bit about how human beings regulate heat. I think it's pretty well understood that if you just got hotter and hotter and hotter and your temperature was 106, 107, 108, that you would die. And of course, that is the case. But even at lower temperatures, your organs start to function improperly, and you can even have death in some of your organs. And so extreme heat is pretty serious for human beings. Many of us probably learned about this stuff in high school, but certainly those of us who went on in medical school, this is how we cool our bodies. And whether it's, and this is a nice depiction of exertional, but when we're running outside and it's 60 degrees, we have all these great ways like convection and radiation and conduction to transfer the heat that we're building up in our body to the outside environment. But what if it's 100 degrees out? And so it's hotter than our body temperature, and we're trying to cool it down. We only have one mechanism, and that's perspiration. That's when we sweat, and the sweat evaporates. And when that sweat evaporates, when all water turns from a liquid into a vapor, it requires energy, and that energy is pretty significant. And so in order to get there and to sort of launch off of us, not to fall off of us onto the ground, which is a waste, but to evaporate, it pulls a little bit of energy off of the surface of our bodies. And over the entirety of our body, it really cools our body very effectively. This is a fabulous mechanism, this perspiration. But what do we do when it's too humid for it to actually evaporate? And that brings us to this chart. The reason the heat index is because it really matches what's happening physiologically. It's not a false equivalent. The reason it feels a lot hotter when it's humid out is because your body is not cooling. You don't have to be sort of like soaking wet for your body to be perspiring and evaporating, and often that's happening even if you're not. But when it's dry out, your body is cooling, and so it doesn't feel as hot. And this can show you how dramatically this changes physiologically for us based on the same temperature. So I hope everybody can see it, but if you look on the left on the chart and you picked 100 degrees Fahrenheit, and let's say the humidity, I live in Los Angeles, let's say the humidity is about 25%, it feels about 100, it feels about 101, and we play tennis and basketball in that temperature. But if you jump to just 50%, which does sometimes happen out here, it's more physiologically like 120. And so vulnerable populations or significant exertional exercise in that same temperature could be quite dangerous. But I grew up in Miami, where it's often 70 or 75 or 80% humidity, and a 100-degree day is killer. And nobody plays tennis in that. It's simply not safe. You would die. It's at the limits of the extreme that we can tolerate. So I hope that helps the understanding of how important the heat index is when we're deciding what kind of activities we're going to participate in and what kind of protective measures, because that's really closer to physiologic impact. I'm going to talk about one more that you'll start to see more often, and that's the wet bulb globe temperature. And this takes into account more factors, such as the sunlight, the angle of the sun, wind, because we know that wind can cool us down. It increases the evaporation. And this is what they look like. And you may have seen these. If you notice, now that you see what they look like, you'll start to notice that often at football games, they have these on a stand on the field so that they're monitoring the physiologic impact to the players. And these are the things that these thermometers take into account that a regular thermometer doesn't, which is just the temperature. And so the heat index adds in the humidity. And the truth is, just those two factors gets you 80 to 90% of the way there of understanding the physiologic impact. But it just makes perfect sense that if you're also standing in the sun versus if you're standing in the shade and there's a lot of wind, that would actually impact it. And that's what that wet bulb globe thermometer gives us. And I think for those of us who are doing research and reading studies, we're going to start to see that used much more often, and even in sports plans. So why are we talking about this? Why is this so important? And the reason is because extreme heat is a real killer. And that's what we're going to get into right now. So we often only hear about some isolated heat waves, which actually can have some pretty dramatic numbers. But if you put together extreme heat and heat illness, it's by far the biggest killer of these climate change impacts. And it's why I've spent a lot of time focusing on that. What do we mean by extreme heat? We're in Idaho, and you may feel like, well, we don't hit extreme heat. It doesn't get over 100 here very often. Extreme heat is defined by the location. So this was a study that was done in the United States that just measured what was happening in emergency departments when it was extremely hot for that area, 95th percentile. So it didn't have to be a certain temperature, just hot in that area. And this was all across the country, 3,000 counties. And you can see the results. ED visits increase. None of us who work in the ER are surprised by that. Heat-related illness increases a lot. Of course, these are the hottest days in the area. But renal disease increased by 30% just because it was hot out, and mental health by 8%. And this is not isolated. This is a trend that you'll see. So if you put all the science together, this is the reality about extreme heat. More people die, more heart attacks and strokes, which are the number 1 and 3 killer, more respiratory ailments, and there's lots of reasons for that, including the increase in ozone, more preterm labor and delivery, which delivers a lifetime of chronic illness to a newborn child. And these are not studies that were done in India. These in particular about the preterm babies, these were done at Kaiser in California. I mean, they're done all over the world, but some of the strongest studies were done in California. So I'm going to pause and just kind of talk this through a little bit. It's really hot out. You're pregnant. You're starting to feel like you have some contractions. You have the ability, Kaiser patients all have insurance. They go to the hospital, get into the air conditioning, get cold IV fluid, get tocolytics, get medications to slow down their pregnancy. And despite all of that, still have more premature babies because it's such a powerful effect. And so now think about, less resource intense areas all around the world. There's more trauma. And when you look at this studies, it's really more interpersonal violence. And so the saying hot under the collar really makes sense. When it's hot, people do want to fight more. And so the intensity of injury as well as the quantity of violent injury increases when it's hot out. And last and certainly not least, more psychiatric illness. And a lot of us noticed this in the emergency department. I think we just assumed it's because it was hot outside, but there's actually more suicides completed when it's hot outside. Who's the most vulnerable? So I think some of these are kind of obvious, but what I like to do when I think about these vulnerable pockets is start to put them together, start to think about real people in your life, and you start to realize that it's not these minority pockets of people. When you put it all together, it's most of us. So infants and children, elderly, homeless, but people who work outside, people who work inside in warehouses that aren't adequately air conditioned because it's, become more important and they didn't need it 10 years ago, but now you actually need it and they don't have it. One of the most dangerous things is working intermittently outside. So think about a school teacher that suddenly is on a field trip and it happens to be hotter than previous days. We'll also talk a little bit about how early in the season is the most dangerous because we're not acclimated. And we do get acclimated to different temperatures, but when it's really hot, suddenly that's much more dangerous. Then you move on to medications. Those who take blood pressure medication, those who take anticholinergic medications, psychiatric medications, are all vulnerable to extreme heat. So it's not these pockets of minorities, it's really the wide swath of the population. I want to really stress that it's temperature for that area. And that's why some of the most dangerous heat waves have happened in areas that we do not think of being particularly hot. It's because it got very hot and people aren't used to it and the infrastructure isn't there for it. So Montreal, not the hottest area I can think of. Tokyo with a huge number of deaths. Again, not a particularly hot area. This is just an example of what happens, how much more mortality and morbidity exists when you're in a resource poor area. But look at this not far from Idaho, the Pacific Northwest heat dome, just a huge, huge spike in heat-related illness, which makes perfect sense and really significant mortality. This is one that I find interesting, and we're getting really more studies about it. And I wanted to highlight this because it's true for heat and it's also true for air pollution. And I think people are surprised by it. It's not just the impact in the moment, meaning when you're exposed to heat on a particular day, you don't think as well. It's also if you're exposed to heat for weeks to months prior to, let's say, taking a test, that our brains don't work as well. And sort of the opposite, but they're both true with air pollution as well. You might think that, well, yeah, chronic exposure to air pollution might kind of clog up the brain or impact the brain and make you not think as well. But we actually have data now that short-term exposure to air pollution also affects the way you think. And one of the studies I found really interesting was they did this with the brain game Lumosity. And they studied how elderly people score on the brain games in various cities and compared it to the AQI, the air quality index, on those days. When the AQI is higher, people perform less well. So this is an example of heat, also true for air pollution. And I just pose this to the audience. If we can't think or create or strategize as well in our hotter future, what kind of future is that? So I know that's a lot of kind of heavy stuff. So I'm going to try to pivot quickly to what can we do about this. But I think what's really important in a practical sense is being able to recognize extreme heat illness and treat it sort of in that medical sense. So I'm going to start with that. This is an incredibly busy slide, and that's the point. I don't want you to try to learn and memorize any of these things. The only thing that's important in my mind about heat illness is if you're starting to experience it, you need to do something about it, or if you have entered into heat stroke, which is an absolute medical emergency. So, what is heat stroke and why do we call it that? When our body starts to get overwhelmed, and that can be passive or active, we'll talk about that, but when our body starts to overheat and we can no longer control it, our organs stop functioning well. But you really can't look at someone and tell that their liver's not functioning well or that their kidneys aren't functioning well, but you can tell that their brain is not functioning well, and that's why we call it heat stroke. So if you see any form of brain dysfunction in the setting of heat or exertion, meaning confusion, dizziness, stumbling, mumbling words, anything unusual, and certainly passing out, that's heat stroke. Think about it in two different groups of people. And sometimes, we have preconceived notions and we think more about one than the other, but make sure you're being attentive to both. So the classic is an elderly person who's disabled, doesn't have air conditioning, maybe has cognitive impairment and can't access water or a different environment, and maybe they're on medications that slow them down. And then kind of the last on the list would be like a toddler in a car. Or not even necessarily in a car, but in a place where they don't have agency and control their exposure. And so this prolonged exposure without relief that can cause heat stroke or heat illness. But just as common are these exertionals. So young, healthy athlete or young person working outside, especially early in the season, especially if they're not acclimatized. So first football practice in the summer, heavy clothing, little overweight, those are all risk factors for heat illness as well. So the top line of this, if you take nothing away, please take this away. Heat stroke is a medical emergency to the point that if you do nothing, 80% will die. So you have to do something. So once somebody has neurologic impairment, and I can tell, we have times I can tell you some crazy stories that I've observed personally about this. Once someone has neurologic impairment, you need to intervene and you need to cool them. Ice bath is by far the best way. And in fact, I did finish line work at the marathon, at the LA Marathon several years, and we always had an ice bath, and we did use it, unfortunately. But there's other ways, cooling and fanning and things of that nature. And then anything short of heat stroke, you want to recognize all the cramps and the rash and things like that, and start to cool the patient down or cool yourself down. And cool soaks really work. Cold shower really works well, but even just putting your feet in a cool bath really works to just take the edge off. And then, of course, air conditioning. But how can we, in medicine, we say an ounce of prevention is worth a pound of cure. And how can we do that when it comes to extreme heat? And so I think it starts by understanding the urban heat island effect. And the reason is because most of us live in the cities, and it doesn't have to be a big city. It just has to be a city with some infrastructure. It's a very local effect. And this urban heat island effect occurs because when the sun beats down on asphalt, it's absorbed rather than reflected back. And then that heat radiates back up from the pavements and from the streets and other areas, playgrounds, all day long and all night long. And so it doesn't cool off as much as it normally would. And that's really important for our recovery, that it cools at night. It doesn't cool as much, but it continues to build up and it makes our cities much hotter. In fact, in most areas, it's about 10 degrees hotter during the summer. And so that's not an insignificant amount. So what can we do about it? And these are some of the things that we can do, like decreasing how much, energy we're burning in these areas. But shade trees and cool pavements and roofs, which we'll talk about more, are part of the solutions, and also using different materials. I'm going to pause for a second and talk about shade trees because they're so impactful. Remember we talked about perspiration and how that works? Well, I'm sure many of you live in Idaho, and it sounds like a lot of people love nature there, which is awesome. When you walk into a forest and it feels cool, it's not just the shade. Trees transpire, which is similar to perspire. It's the same thing. They pull water out of the ground and they release it out of their leaves. And when that water evaporates, it cools the air and it cools the trees. So forests and trees really do cool the air, even beyond the shade that they provide. So putting shade trees in is really impactful for cooling an environment. Heat action plans are really important. Understanding when it gets dangerous in your community and having a plan to help the vulnerable people. And that could be cooling centers, water delivery, and outreach to high-risk populations. All of this is in place in Los Angeles, for instance. There's actually water delivery to the homeless encampments and Skid Row. And there are systems in place to try to contact people, let's say in nursing homes. I'm personally aware of primary care clinics that have a list of patients that are vulnerable and live alone. And when the temperature gets to a certain, when they use heat index, when it gets to a certain heat index, they actually reach out to all of those patients to try to make sure that they have a safety plan. They've got family getting them, whatever may need to happen. This is just one example, but this is a school policy. And the point is just to show you on the left that the school policy is not by temperature, it's by heat index, because that's what matters. And there are certain heat index values, 115, you could see that was lower than the 100-degree, 50% humidity. So if they were just going by 100 degrees, they wouldn't understand that they had to stop sports. But by using heat index, if it's a day that's not 25% humidity around here, it happens to be 50%, but 100 degrees, we're going to cancel all sports. We're going to cancel PE. It's just too hot. Let me talk about this cool surfaces for a minute, and this is a little bit more technical, but I find it really interesting, and I'm all about, what we can do to solve these problems, and this is one of the more innovative and new strategies. But again, I said everything we're going to talk about is things that are in place, and so the group that I'm associated with, Climate Resolve, we've done multiple projects, and others have done multiple projects throughout LA and other areas where we're already applying these concepts. So starts by understanding albedo, which is a word for solar reflectivity. And all this sunlight pours down on the earth, and the greenhouse effect is that as it's being reflected back, the more CO2 and other greenhouse gases is trapping more of it. But what if we changed how much is being absorbed right at the surface and radiating back, and we reflected more back? And so, as you all know, when you're, out there in an area that's really white and reflective, all of that sunshine just reflects right back. So a perfect albedo of 1.0 or 100% would be like the perfectly white surface that doesn't absorb any of the light. And then the flip side, unfortunately, all the way on the other end is fresh asphalt, which is really, really dark and made of a material that absorbs. So it is very, very low albedo. And then you can kind of see the areas in between. The Earth's average is in the low 30s currently, but if you look at it over time, Earth's average is decreasing, which means in addition to the greenhouse gas effect, the albedo effect also means that we're absorbing more heat here on Earth than we did in the past. And it continues to move in that direction because things like ice caps melt and goes from that white reflective surface to dark water that absorbs heat. And so this is impacting the world in a larger effect, but it also has really powerful impacts locally. This is the most complex slide I'm going to show you, and it's a way of sort of tracking this difference between the energy that's coming in and the energy that's radiating back out. And the yellow on the graph is the sun energy, and the blue is what's radiating back out. If you look on the left, it looks like really dramatic differences, but if you look on the left, you can see that the y-axis is really very, very narrow, from 338 to 342, and we're going all the way back to the 1980s. And as you move forward, you can see that now in the 2020s, there's a pretty significant and consistent difference. That difference is only 1 watt per meter squared, but there's a lot of square meters on the planet. And so that's a lot of watts overall that are creating this imbalance that's contributing to the warming of our world. So what can we do? We can apply cool surfaces that reflect this. And I'm going to go through some of the features and benefits of the cool surfaces, but the bottom line is that they do two things, which is that they locally cool the area and make it more comfortable, but also have this greenhouse gas reduction equivalency that can potentially be more impactful than just the local environment. So we'll start with what are cool surfaces. They can be anything: roads, sidewalks, playgrounds, sports courts, parking lots, roofs, walls, and we've done all of these. You can use all colors. They don't have to be white. It took me a moment to understand, and I needed to see the graphs, but part of the reason these surfaces absorb so much energy is they not just absorb the visible light, they also absorb infrared, and they also absorb ultraviolet and then radiate that heat back as well. But what we figured out is that we can make cool paints of any color by using materials that still reflect all that infrared and ultraviolet and just absorb the visible light wavelengths that we want to see in the color. So no, brown paint does not have as high an albedo as white paint. White paint is very close to 1. But there are brown and black paints that are in the 40 to 50% albedo range, which again is much, much better than the pavement is currently. It reduces the local surface temperature really dramatically, about 10 to 12 degrees, and the ambient air temperature is about 4 degrees. So this is really impactful. So we've done sport courts, and when you're playing basketball on it, it's great because the court's not hot. And then we've done studies at about a 5-foot level to show that in areas, I should take a step back and say that one of the projects we did a school playground, basketball court, but also we did 10 by 10 city blocks around the school. So we had a whole area to measure. What if we did a large area where we did all the pavement with these cool coatings? And we found that the next summer, when it was hot, the ambient air temperature in that area was 4 degrees cooler. And now we hadn't even added the shade trees. So I think if you did them in combination, you could probably get close to that full 10-degree urban heat island effect just by changing the surface and the tree cover. The greenhouse gas reduction equivalents, these are incredibly complex formulas. You can Google Shine On and Climate Resolve and get our white paper, but they're real. You know, how large or small or where the right place is up for debate, but there's no question that it's real. There are additional advantages. These seals often extend the life of the surface. So instead of repaving every 6 or 7 years, you may be able to repave every 10 or 11 years, which would then pay for the cost of the seal. And you'd get all of that reflectivity for the 10 years. Decreased cooling costs when you put, a white roof over your warehouse, and which can decrease AC use, which would then decrease really powerful greenhouse gas generation. One of the things I think is really important about it in this moment, Dr. Pierce touched on the political moment that we're in, is I'm not aware of any entrenched opponent. There's no dark asphalt industry that's going to really be opposed, I think, to us coating over it with reflective material or making slurries and paving with a new material, and they would still get all of that same work. So it feels like something that we could get in place and move forward really rapidly during the next few years, despite what's going on. And it's ready for deployment now. The city of LA has done areas all over because they want to be really careful. And so they're studying the safety of, let's say increasing or decreasing accidents, or, is it more slick in the rain? The truth is there has not been any evidence of that. And so they're starting to move forward with more widespread implementation. This is really cool. I'll leave this for a second. So Bill and I partnered with Climate Resolve and did a video. It's about 4.5 minutes that really explains a lot of what I did, but in a much cooler and more entertaining way with color graphics. And so I would grab that QR code. Sorry, it is on YouTube, so there's some ads, but I think a really cool video. All right, coming back to sort of something similar. Again, about solutions. And I think this is impactful to know. The sun pours enough energy on us every hour to power the entire world for an entire year. And I hadn't heard what Dr. Pearson mentioned about the lightning, but it's a similar concept. All we have to do is capture it. But the difference here is we actually already know how to capture it. And my solar panels are now 9 years old. They're all paid off, and I should have essentially free energy for my home and my cars for the rest of my life. I know plenty of people whose solar panels are over 40 years old now and still producing energy. So it's one of these where you build it and then you have energy for the rest of, for decades to come. And so it just makes perfect sense. And if we build enough of it and the other modalities that we're well aware of work really well, wind turbines and geothermal and wave technology, so many ways to produce enough energy for us to live happily and comfortably without producing greenhouse gases. We know how to do it. We just got to do it. This crowd I know doesn't need this slide, but I think they may need to know this information because you will still run into deniers, which just blows me away. So denial is no longer a strategy even of the fossil fuel companies. This is simply fact that this is happening. It's simply fact that it's human caused. We now have the evidence that most of these oil companies knew about this back in the 1960s and 70s, which is why they built their oil rigs in the ocean so high. They were well aware, and if you look at the graphs that they had internally from their scientists, they absolutely match almost perfectly what has then transpired over the resultant 40 to 50 years. So they knew exactly what was happening. They no longer deny it. Now they just greenwash it. So don't let anybody deny it to you. You just tell them, not even the oil companies deny it anymore. And unfortunately, I think this slide really captures the moment that we're in. The world is burning down, and we've just elected a president who wants us to just keep playing golf. And so we have to figure out how to turn this around and how to wake up to the emergency that's on our doorstep, stop playing golf, jump into action. I know the people in this room are doing that. And but I think this slide kind of says it all about this moment, and we need to push for change. That's all I got. Thank you so much for your attention. You can grab my email at the bottom there. I'm happy to answer questions that way as well, and more technical things, and don't hesitate to reach out. I'd love to talk about these issues.
Hi, I'm Melissa Root, Primary Care Doc here in town. Thank you so much for your talk. Super interesting about the cool surfaces. That's brand new to me. I have a question about just patient care resources and primary care. That's kind of like the people I have access to. I kind of think about like my healthcare administrators are my mitigation people, and then I'm kind of like the how do I help my patients adapt person. So just curious as an ER doc if you have resources about heat that you give to patients. Something that I use a lot is AmeriCares, and they have a healthcare like heat toolkit, but curious if you have other resources for us potentially.
Yeah, I think AmeriCares is one of the best. And so that's good. I know Eco America has a lot of resources. I'm part of the Medical Society Consortium on Climate and Health, MSCCH. And so if you look up them, they have a resource page. So I guess it kind of depends on what you're looking for. Like in my ER, we keep it pretty simple. I think people are aware of this situation. And so what we really have, but we post handouts right at our triage for the cooling centers when they're open, when people need that.
Hi, Mark. It's Jen Pierce. Great talk. Thank you so much. My question is about something that you articulated really well, which was this heat effects, and I'm particularly interested in the heat impacts on our agricultural workers and our construction workers, and just knowing that oftentimes those folks may not either feel like they could go to the emergency room because of their insurance situation or what have you. So I guess I was just curious, how do you think that, tell me more about the impacts on those particular groups.
Yeah, this is a major issue in California, a big agricultural state, and it's obviously very hot. And then a lot of, let's say, undocumented immigrants, people who don't feel like they have agency, they're told to work, they have to keep working. So California actually has pretty strict laws around it, more than most states. And I'll share some of the important features. I think prevention is really the key here, but also recognition. So educating, let's say, foremen, and even some of our proposals around the federal heat standards would include education of the line workers as well to recognize heat stroke, recognize when someone is experiencing serious heat illness, because that's a 911 level emergency and requires action right then. So that's one aspect of it. Prevention, a lot of agricultural workers, they don't have any kind of shade set up anywhere, and it's really not that hard or expensive. They don't have water available. Some bring their own water. Well, how much water can you bring and carry if you're going to be working all day? There are states that have actually enacted laws preventing municipalities from creating laws similar to what's set up in California, that rest breaks are required, shade is required, water availability is required, restroom breaks, things that just seem normal and natural. And so I honestly don't know what the laws are in Idaho, but there's really simple things that can be done to kind of prevent these. Earlier work hours. It's really about the awareness, so that people can take care of themselves.
Great. Thank you very much. I don't know what the laws are either, but I'll try to find out.
And what's interesting is California just passed indoor cooling laws, but almost no other states have indoor laws, which would fall under OSHA in most states. And that's because it just hasn't been that necessary. Most workplaces that are sort of like white collar have air conditioning, and warehouses in a lot of areas just really didn't need it, or the feeling was that the workers didn't need it. But now we're seeing that that's really dangerous, and got young workers who are, passing out and having severe heat stroke from being at work in non-air conditioned places. So another area to focus.
Hi, my name's Callie. Thank you very much for the talk. I've really enjoyed it. We've talked a lot about structures and infrastructure and things we can do in the clinic. I was wondering, because we have areas of the world that are hot and humid right now, and they have developed folk knowledge and culture around how to deal with that. That as we become here in Boise more like Phoenix, that we don't have. What work is being done on developing and taking some of that folk knowledge and getting that ingrained in the community so they have that basic knowledge of how to keep themselves safe?
Yeah, that sounds incredibly valuable. I'm not knowledgeable on the topic. I hear more about it related to wildfires and wildfire preventions and kind of the way that's been handled. I haven't heard so much about it related to heat, but I don't doubt that there are sort of more natural and holistic ways. Certainly the way we would build, as an example, even hospitals, which we think of as like very structural locations in other areas like India where it's hot, are built differently so that there's a lot of airflow, which is probably healthier in some ways, but it's because they don't rely as intensely on air conditioning. So I don't doubt that there are ways that we can either build our infrastructure or modify our lives to keep us cooler, using sort of original or native concepts. I do want to go back to what Dr. Pierce asked just for 1 second, because I thought of one other piece that I think is really important that people often don't understand, and that's the acclimatization piece. And I talked a little bit about it, but it takes time for our bodies to change and get used to heat, which is why it's really dangerous when it first changes. But that's also true when you first start a new job, either outdoors or that's very exertional. So over the course of 2 to 3 weeks, we actually sweat less, our heart rate increases less, we put less salt out in our sweat because our body starts to recognize that we're going to lose too much salt if we put too much in it. And so our bodies literally change how we react to heat over the course of just a few weeks. So going again back to like the regulations in California, a new outdoor worker has to ramp up their hours over the first couple of weeks, a few hours the first few days, etc. And so some of that conceptual stuff I think is really important in terms of kids' sports and again, all kinds of situations. And the most dangerous thing is to not really have any significant heat exposure and then be outside all day exerting in unusual heat for that day. So we're kind of right into the danger zone here. And you probably saw in some of the dates of some of those big heat waves, a lot of them are late May and in June, not in August, because in August, people are fully acclimated to what's happening.
Mark, thanks for your nice talk. I'm wondering about not so much the effects of extreme heat on health, but of sustained low to mid-level dehydration as temperatures just gradually creep up. We have medical guidelines on liquid consumption per day. Is that a health risk also, where we're outside and we're all sort of slightly dehydrated all the time?
Absolutely. You know what we see most commonly in the agricultural workers is the development of frank renal failure. So again, these are people who don't go and visit doctors and they don't have blood tests done and they just work through and they never pass out and they never have extreme heat illness, but they're working in the hot sun day after day after day without any monitoring. And they'll be in the field and we're talking about young people in their 30s or 40s, and they've been working in the fields for 5 to 10 years. And suddenly they start to swell and they come in and they're in end-stage renal failure from this chronic dehydration and exposure. So I do think, and those are extreme examples, but I think it's right on what you're saying, that I don't doubt at all that in a hotter, drier environment, our kidneys are going to take a hit if we're not careful about it.
Having lived through the Oakland Hills fire way back when and watched my patients die of the stress of losing homes, and knowing, living in the Bay Area, that San Francisco has a lot of parkland, undeveloped territory on the mountains, on the hills, I guess you call them hills, and clearly what's happening with the LA fires and the San Rafael fires, we don't seem to be able to separate urban from wildfire at this point. The destruction that I saw in San Rafael, the Oakland Hills fire that I lived through, the LA, that just happened. Are we looking at what those wildfires in city add to the carbon dioxide emissions and what's happening there? I mean, you're looking at places around schools. Are you looking at what happens when you have a catastrophic situation where you've added wildfire?
Yes, so many important aspects of your question. So I'll start with a few of them. One is the really frightening feedback loop. And when you read about climate change, there are certain feedback loops that are really concerning. And one of them is wildfire, because it puts out a lot of CO2 and then gets worse as it gets drier and hotter, right? I think in terms of the interface of the urban and wildlife community, where we're seeing a lot of destruction and damage and honestly pain, isn't a major contributor to those really serious feedback loops. Because I think if you think about it, these massive wildfires that were in Canada, that were engulfing the East Coast, or that you may be experiencing up in Boise, are actually far, far larger than, let's say, the Eaton fire that destroyed 10,000 homes here in Altadena, which is right next to where I live in Pasadena. But I do think that they're highly toxic and maybe underappreciated. And so, similar to the example that I gave, that once you're overheated as a pregnant patient, even if you go into the air conditioning, you get your cold IV fluids, you get cooled off, you get your tocolytics, you may still progress. This is the same thing. We see this a lot with the wildfires. People may have respiratory illness, may even get hospitalized, get some treatments, get feeling better, but they will continue to do poorly for a month or two. And I can unfortunately think of one example, a friend of mine's uncle who was diabetic, renal failure, on dialysis, had to evacuate from his home, so was exposed to a lot of wildfire, did develop respiratory symptoms, went into the hospital for a couple of days. They thought they had the respiratory symptoms resolved, but never got his diabetes under control and never even got and did not do well through his dialysis. And over the next 6 to 7 weeks, continued to just deteriorate despite medical care and actually passed away. And I am convinced that was from inflammation from the wildfire that his body just never recovered from. Last but not least, in your question, when we burn homes, we burn really, really toxic stuff, particularly in our cell phones and our electronics and in our cars. And if you drive up to Altadena, it just looks like a bomb went off, and you see shells of cars and chimneys. And so all that stuff burned, and all that stuff is soaked into the ground and blown around in the air. And that's why we've got the Army Corps of Engineers out here, and there's trucks everywhere, and they're digging up the dirt, and they're disposing of the dirt and laying down new, because this is highly toxic stuff when our urban environments burn. And so again, there's really significant health risk for, think about a city of LA, covered in this really toxic smoke for a couple of weeks. There are going to be health impacts to that. So it's all very real. Talking about it this way just makes me feel like it's so disappointing that we didn't attack this problem when we figured it out, that we were persuaded that it wasn't important and it wasn't impactful. And it's happened again right now when it's so obvious how impactful and present it is. So all I can say is let's get out there, and like Dr. Pierce said, let's talk about it. Let's talk intelligently about it. Let's share facts. Let's make sure people understand that we cannot ignore this. It's just simply not an option. And we won't ignore it, because it'll get worse to the point that there's no discussion and we're all attacking it. But every day we delay just makes the problem worse and the solution harder.
Thank you so much, Mark. That was an incredible talk, data-driven and really helpful. I just wanted to comment because I actually spoke last month on agricultural workers and heat exposure in Idaho, and answered Jen's question as well as Tom's, that in Idaho there are no protections. And OSHA is just a recommendation nationally, but in California, Washington, and Oregon, there's some state regulations that protect the farm workers, but in Idaho there are none. There is the Immigrant Resource Organization Council, which is a nonprofit here that's working to educate the farm workers, work with them on the ground, speak in Spanish, disseminate information about like hydrating and staying safe in shade structures. But right now we do not have any protections, so they are super vulnerable.
Which is an opportunity for action, right? Get those regulations in place.
All right, thank you very much, Dr. Futernick. We appreciate your time.